from the brachiocephalic. And the two vertebral artery will come from now subclavian, mashallah. Right. So the internal carotid arteries will be supplying this part of the brain. It's called the anterior circulation, most of the brain. Posterior circulation, which includes the brain stem and the cerebellum and the posterior aspect of the occipital lobe of the brain, will come from vertebrovascular circulation. Two vertebral arteries, they become a single basilar artery. Now this is the common carotid artery. It bifurcates here at the level of the what? Thyroid cartilage. You see them taking pulsations here, right?
Yes.
They press against the thyroid cartilage to take the pulsation of the common carotid. It divides into external and internal. External goes to the face, and within the substances of the parotid gland, right? This is the parotid gland here. It will divide into two terminal branches, maxillary and the superficial temporal. Maxillary and the superficial temporal. Maxillary is very important. We're going to talk about it later on. And it will supply the face, the scalp, and so on in that area. While the internal carotid artery, you can see it going up in the neck with no branches. Okay? No branches for the internal carotid artery in the neck. And then it's going to enter here. That is called the carotid canal. So it enters through the base of the skull, through a carotid canal, and will pass through the cavernous sinus. So that is the cavernous sinus. It will pass through the cavernous sinus together with cranial nerve 3, 4, 6 and 2 divisions of 5, except the mandibular. Okay, so 3, 4, 5 and 6 minus the mandibular division of 5. And then it will pierce the dura mater to reach the ventral surface or the base of the brain. Okay, so this is the internal carotid artery, no branches in the neck, in the carotid canal, into the cavernous sinus, leaving the cavernous sinus, piercing the dura mater, and it will be from there distributed to different parts, will branch there at the base of the brain or the ventral surface of the brain. So this is the internal carotid artery. What we did, we just basically, the brain was sitting like this, and the internal carotid is coming like that, right? From the base. So what we did, we took the brain out, flipped it over, and this is the view that you will see. So this is the internal carotid artery. It will give us 3 major branches. Direct continuation is the middle cerebral, and then it is the anterior cerebral, anteriorly, and posteriorly we have the posterior communicating. So internal carotid artery will divide into 3 main branches. Direct continuation is the middle cerebral. Anteriorly is the anterior cerebral, and posteriorly is the posterior communicating artery. Today's lecture is about these main branches. But internal carotid artery, before it divides into 3 major branches, will give us smaller and yet important other branches. One of them is the ophthalmic artery. Ophthalmic artery, as the name implies, it accompanies the optic nerve through the optic canal to supply the eye, the retina, and all of that, and then it will supply this part of the face and the scalp, okay, and the nasal sinuses. Like this, it will supply this area plus the eye in black. That is the ophthalmic artery. It comes off the internal carotid artery while within the cavernous sinus, and then it will accompany the optic nerve through the optic canal to supply the eye, and it will supply that area. Now here it's going to anastomose with this artery. This artery is a branch of the external carotid. We call that the angular, which is continuation of facial. So this is a branch of external. So this area is very important. Number one, it provides anastomosis between the internal
and the external.
and the external. يا شباب. ها؟ Internal and external. This is number one. Number two, what happens if you get a blow to that area?
Bleeding from
You will bleed profusely, right? We're talking branches of internal and external carotid artery. So that is artery number one that we're going to talk about, other than the major artery. The second artery, this one, which is basically this one, which is that one, it's called the anterior choroidal artery. And as the name implies, it goes to the choroidal plexus within the lateral ventricle. You can see it here. This is the internal carotid. This is the middle cerebral, direct continuation. And this is the anterior choroidal going to the choroidal plexus within the lateral ventricle. But this artery will supply other structures. Basal ganglia, internal capsule, which is very important structure, optic tract, amygdala, and all of these structures. Now this artery is prone to thrombosis because of it is long and tortuous course. Consequences of thrombosis of this artery are grave simply because it supplies the internal capsule. Internal capsule is about at this side. You know, maybe half of the length of your finger, and yet it is extremely important because it receives all the descending and the ascending tracts from the cerebral cortex. We'll talk about it a little bit later on. Okay, so the internal choroidal artery, which is one of the branches from the internal carotid artery, is long and tortuous. It supplies all these structures, in particular the internal capsule and the basal ganglia plus the optic tract. So in fact it is prone to thrombosis because of long and tortuous course. Now if there is a thrombosis in that artery, you will have hemiplegia. Imagine that tiny little artery will have hemiplegia, hemianesthesia, so complete loss of movement and sensation. And you might have homonymous hemianopia because of the involvement of the optic tract. Okay? Other smaller arteries that will come from the internal carotid artery, we have the superior and inferior hypophyseal arteries. Hypophyseal refers to the hypophysis, which is the pituitary gland. So these arteries will supply the pituitary gland, the infundibulum, and the portal circulation between the hypothalamus and the pituitary gland. Okay, so we'll supply the pituitary gland and the infundibulum and the pituitary portal system. Now let's talk about the major arteries, major divisions, major branches of the internal carotid artery. First one is the direct continuation of internal carotid, and we're going to call that the middle cerebral artery. This middle cerebral artery is prone to, again, because of this direct continuation, so if there is thrombosis going through the internal carotid artery, if there is emboli or there are emboli, they will go directly to the middle cerebral artery. So the most commonly affected artery with these things is the middle cerebral artery. Now, middle cerebral artery, here, this is the internal carotid. Middle cerebral artery is a direct continuation. And it is heading towards what? Towards the lateral or the fissure of Sylvius. The lateral fissure. Why? Because its final destination is the lateral surface of the cerebral cortex. So how it's going to reach the lateral surface of the cerebral cortex? So it's going to go from internal carotid, middle cerebral, lateral fissure to the lateral surface of the brain, like this. So you could see it coming from the lateral surface of the, from the lateral Sylvius fissure to the lateral surface of the brain. So I'm going to repeat that. Middle cerebral artery is a direct continuation of the internal carotid artery. And you can see it heading towards the fissure of Sylvius. Why? Because its final destination is the lateral surface of the cerebral cortex. Now, before it reached the fissure,